Today, my group and I will present three main public health issues that need to be addressed urgently in Malawi. As Malawi is in the early stages of the epidemiological transition, its burden of disease is largely comprised of communicable or Group 1 disorders. The country's health outcomes has improved quite significantly in recent years. More than half of Malawi's total DALYs are attributed to communicable, maternal, perinatal, and nutritional diseases. This is indicative of a developing country that has prominent changes to make in order to see improvements in health outcomes. In the early years of the millennium, HIV and AIDS was the leading contributor to the burden of disease in Malawi, followed by lower respiratory diseases, malaria, diarrheal, and perinatal conditions. Malawi is affected by high rates of child and adult mortality and the high prevalence of diseases such as tuberculosis, malaria, HIV/AIDS, and other communicable diseases. However, there is also a growing burden of non-communicable diseases, accounting for over 30% of all deaths. The three main public health issues that we will be discussing today are respiratory infections, diarrheal diseases, and malnutrition. In addition to discussing the consequences of these three main health issues, we will also discuss interventions that can be put into place to reduce the prevalence and severity of each public health issue.
Our choice to direct our focus on Malawi's water quality is based on the fundamental nature of clean water. Clean water delivers a foundation of health, and without it, many concerns can arise. The most fatal complication that comes from unsafe water is diarrheal diseases, which are a leading cause of death in Malawi. These diseases are extremely dangerous, especially for children. They cause severe dehydration, which can be fatal in those with weakened immune systems. As diarrhea is known to be treatable through ORT and zinc supplements, it should not remain a leading cause of death in children. We believe that for this issue, the answer is in prevention rather than treatment. Malawi needs improved sanitation. We plan to conquer Malawi's poor water quality through the implementation of pit toilets, which collect waste in below-surface holes. Pit toilets are highly cost-effective and can last up to several decades. They prevent the spread of bacteria through containment of waste, limiting pathogens in water and air. Additionally, they address a core issue of normalization of open defecation by changing harmful cultural practices.
So furthermore, air pollution is a public health issue that requires immediate action. This problem is largely due to Malawi's burning of solid waste. Although a cultural norm, this practice reduces indoor air quality and puts the lives of citizens at risk. According to statistics reported by WHO in 2018, respiratory infection is one of the leading causes of death in Malawi, which is aggravated if not caused by burning solid waste. So addressing the issue of indoor air quality will reduce the disease burden due to respiratory infections. This prevents premature death and improves the quality of life of individuals. So from research of Nguyen, and Pham in 2014, household air pollution caused from burning solid fuels is the leading risk factor in Malawi. Indoor air pollution can have harmful effects on the health of individuals due to the accumulation of pollutants. For example, the accumulation of contamination resulting in indoor air pollution can have both immediate and long-term effects. So many short-term effects include dizziness, nausea, migraine, and eye and throat irritation. Long-term effects may show up decades later due to respiratory disease or disease correlated to cardiovascular system. Therefore, the intervention we are proposing is the introduction of kerosene stove to address the high rate of indoor air pollution contributing to respiratory infection. Kerosene stove are a cost-effective way of eliminating the amount of pollution that can be caused by burning oil. In addition, kerosene stove fuel can be stored easily, offers fast cooking, and is cost-effective as it can be obtained in small quantities. Cost efficiency is extremely important in a developing country such as Malawi, as most people live below the poverty line and struggle to live on a daily basis.
Malnutrition is a condition that largely develops in children within their first 1,000 days of life. It is caused by severe lack of necessary nutrients. This results in stunting of physical and cognitive development to an irreversible extent. The long-term consequences due to chronic malnutrition are transgenerational, meaning children who are stunted become stunted adolescents, then become stunted adults who then give birth to stunted infants. Prioritizing chronic malnutrition will contribute to the improvement of immune and cognitive development across the lifespan. Malawi's nutrition has worsened due to the severe food and nutrition insecurity in the country. We propose that there should be a distribution of a daily multivitamin to all children in Malawi under the age of 5. Multivitamins can act as a replacement for the nutrients that are not readily available and allow the body to be strong and healthy. If children in Malawi begin to develop a strong foundation of nutritional adequacy, they will become healthy and cause a break in the cycle of chronic malnutrition. In order to supply multivitamins to all children throughout Malawi, we believe that it is essential for organizations to come together and work efficiently to distribute the multivitamins and provide nutritional support.